Hello, we are back with the promised podcast with Dr. Abhay Chopada, a leading gastroenterologist in the UK with several years of amazing experience working on the gut microbiome, using the knowledge he has about the gut microbiome to treat his patients. After the fantastic first podcast, we have decided to focus on something that is very, very significant: irritable bowel syndrome, or IBS as we know it. 1 in 10 individuals worldwide suffer from it. A lot of people don't even know what it is or they are suffering from it. It's a very, very painful condition. So, we are going to talk about many different aspects. Are you suffering from IBS? Do you know somebody who is suffering from IBS? Maybe you'll find some solutions here. Welcome to this podcast, Abhay.
Oh, thank you, Rashmi, for having me. I'm really pleased to be with you because after our last podcast, I realized that this is my learning journey too. So, I'm very happy to
It is
answer
a
your
lot that,
questions. Irritable bowel.
yes, it is a lot that we are learning from you, and I'm glad that you also call it a learning journey. I'm sure the viewers have learned a lot about the myths that people have about gut health in general. So, if we talk about one of the most common conditions, it's a very common condition that we see now. It was not so prevalent 2 decades ago, which is irritable bowel syndrome. We have discussed this outside the podcast. It is something that a lot of people are suffering from. So, what are the things that you would like to, from your perspective, talk about IBS?
Thank you very much. First of all, let me put it this way that IBS is one of the most common conditions we encounter in GI practice. And what has happened is over the last several years, as our dietary habits have moved away from natural food to processed food, we are seeing more and more people complaining about things like abdominal discomfort, bloatedness, bowel habits going wrong from constipation to diarrhea. Some people have even been depressed due to their gut. So it's not exactly a benign condition. And traditionally, in allopathic viewpoint, we've always said that irritable bowel syndrome is a functional disorder. In other words, I rule out anything organic. And if I can't find anything else, I attach the label irritable bowel. I'm so fortunate that now we've started realizing that it is not exactly just a functional syndrome. There is a cause. There is something that we can manipulate. And this brings back to our old adage, which we learned in India, that you are what you eat. And today with IBS, its analysis, I can once again go back to the same adage, that you are what your gut flora is due to what you eat. I'll just add that extra word in between.
Hi, I'm Dr. Rashmi Kulkarni, co-founder of genx Solutions. Sorry for the interruption. Just wanted to highlight the things that we are doing at genx Solutions. We provide digital resources for the microbiome, like the Human Microbiome course for all students and professionals in the fields of life sciences, nutrition, and medicine. Now you know why it's so important to learn about it. We have a mobile app for children to develop healthier habits for their gut microbiome. We do webinars and outreach program for a general layman audience. We also have our own Shatayushi 360 degrees total transformation program to improve the gut microbiome and try and reverse chronic diseases. We do research related to the gut microbiome. Please continue watching the podcast. I hope you enjoy it. Amazing. So when you see IBS patients, I'm sure if we talk about the number of people who were coming with these kind of symptoms previously, a decade ago, versus now, and the age groups that are coming with it, and what are the kind of things that can be done? Is it something that can be resolved easily after the
Absolutely.
diagnosis is made?
Yeah, I think we'll have to dig back into what is IBS. First of all, IBS is a functional syndrome, so it can happen at any age. You can be as young as 10 years old, or you can be 80 years old, and you can still have IBS. There are a lot of conditions that we now know trigger irritable bowel. One of the common conditions is actually post-infective. In other words, you might have had a mild gut infection or a food poisoning, but the gut remains sensitive. The question is why? And therein comes the gut flora. We are now firmly of the belief that your gut flora needs a complete balance between various different microbiome microbic species, so to say. And if we get an altered balance, whether it is due to the infection per se or whether it is due to the treatment of that infection, you get a condition called dysbiosis. Now, you need to understand that your gut is not a simple organism. It actually is an ecosystem in itself. And we now recognize that your gut talks with your brain. It is a proven thing that there is a gut CNS axis, gut brain axis, as we call it. Now, what happens if there's a dysbiosis? The gut flora not just irritates the gut, but it also affects the CNS, which now actually misinterprets the signals that which normally it would get from the gut. And it creates altered motility, or visceral hypersensitivity. And these are very big words, but essentially you actually have an altered perception. Now, if you really have real sensitivity, you can feel pain. You'll feel a sense of a knotting in the stomach to say something's not right. If your motility is affected, you say, I bloat like a balloon. There's a very classic feature of this, and I always ask the people that listen, when you wake up first thing in the morning, how are you? And if you've got IBS, typically you are actually quite flat because during the sleep, the gut axis has been okay because your brain is silent. And throughout the day, now you are over interpreting the gut axis goes. So throughout the day, your belly starts actually swelling up. And I have many, especially women, telling me that, Doc, by 5 o'clock in the evening, it looks like I'm pregnant. Can we do something about it? Now, conventionally, since the 1970s, we have actually treated IBS as a symptom management condition. So if you have diarrhea, we give you Imodium. If you have constipation, I give you fiber, laxatives to help you. If you have pain, I put you on antispasmodics. I might sometimes even give you amitriptyline. And herein lies a very interesting thing that I had never realized before. Amitriptyline is an antidepressant. And I was thinking, why would an antidepressant work for visceral hypersensitivity for the pain? And the more we are realizing that it is more to do with how the gut flora is affecting the brain, you start realizing that it does make sense now, right? So essentially, we are now starting to realize that there is a much bigger role for your diet, your lifestyle, and balance of your gut flora. And I'm sure I don't need to convince you about how important that balance is because you come from the space where for you the gut flora is absolutely what you're an expert in. But even as someone who's not an expert of your level, I can tell you one thing that prebiotics, probiotics, dietary manipulations, FODMAP diets, they all work. And they work to do only one thing, create the balance back. And if you have your gut flora in balance, I promise you, you'll feel very well.
Wonderful. So, is this the standard line of treatment now that giving probiotics, prebiotics, or low FODMAP diet? Is this what is considered the standard form of treatment for IBS?
Okay, not
And
yet.
how does that help in the long term?
Not yet. You need to understand that clinicians usually are a very slow species when it comes to evolution. And that is because we actually need to be convinced we have to take these decisions on behalf of our patients. And one of the reasons I actually was excited about this podcast was I actually can push it in my own circles. Because not every clinician is completely comfortable with his understanding of the gut microflora. It was not something we were naturally taught when we went to med school several decades ago, really. This is evolving information. This is an evolving science. Yes, we talk a lot about it in our conferences. In fact, most of the conferences I've attended over the past few years, we've always talked about gut flora. Having said that, practical utilization of manipulation of the gut flora is a not fully understood approach from clinical perspective. So if you tell me today, if I have someone with prebiotics, how would I treat him? Yes, I'll start him on fiber if he's constipated. I might even put him on VSL3 or Simprove to say, hey, I need to start you on prebiotics. But I don't have any clear way of actually checking the before and the after. And at this point, I'm actually going to ask you a question, Rashmi, which is really relevant to me. I mentioned to you this.
Okay.
But what is a practical way for my patients to get access to a full analysis of their gut flora so that we can actually check pre and post manipulation differences and actually say, yes, we've now got the balance back?
Yes, so I'm going to answer that. That's a very interesting question that you have put across. We are working with similar patients who come with IBS and they have been suffering for several years, some of them 10 years, 20 years, without any respite of the symptoms. And then now we are looking at this from a completely different perspective. We start everything by looking at the gut microbiome or any other microbiome for that matter. So the way we look at it is, if there is no dysbiosis in the microbiome, if the microbiome is highly diverse, if it is healthy, then it is going to make everything else right. There won't be any diseases, so to speak of. So when we are talking about something like IBS, there are many considerations in this. One can be actual food insensitivity or food intolerance, which can be caused because of dysbiosis. The other thing that we see is actual infections. So when people have infections in their gut, and when they get treated, like some people suffer from diarrhea after eating some street food or something outside, and then they think that it is resolved. But what we are finding here is that these people have this the persistent infection. I'm sorry. They have a persistent infection with a single pathogen, with two or three or multiple pathogens that they are carrying in their guts for years, and these are not detected. So this is why we recommend, or we do microbiome testing for them, where we actually sequence all of the microorganisms, the majority are at least, the bacteria, fungi, protozoa, viruses, even in their gut, using a stool sample. It's as simple as that. And then what we see there is there are actually infections that are present, and they can explain why they have IBS. Then it is much easier for them to get that kind of specific treatment for those pathogens. So this is what we are doing right now. And then this can be a before and after microbiome testing to see whether they've actually gotten rid of those pathogens. So that is something we are working on.
Perfect. It'll be very helpful if you could provide us a practical link as to where we can access this
Yes, yes,
when we
absolutely. We
upload
can do
this
that. And
podcast. Yeah, yeah.
yes,
I'll tell you
absolutely. So
simply,
that is something that is new.
it is. And like I said, it is a very valuable therapeutic tool for doctors, especially for us to convince ourselves that the theory and the practical matches. Because, like I said, right now I don't have any other tool to be sure that my gut manipulation is working. And if the patient says, I feel no better, I don't have a way of actually cross checking whether it is a compliance issue, an absorption issue, or it is the microbiome has not really budged. Now, I've got another question, and I'm sorry it feels like I'm interviewing you, but I
No,
really
no,
also
no
want to
problem.
talk about diet. And there is another axiom that you should actually stick to what is your local produce that usually is the best diet for you. How true is that when it comes to your microbiome? Is your local produce, what you can grow in your local area, much healthier than food that you might be importing from thousands of miles away?
Yes, that's a great question. And yes, we always promote eating local and seasonal food. It is very important for the microbiome. There are several reasons to it. Anything that is grown locally grows effortlessly without having the unnecessary use of excessive use of fertilizers and pesticides. So it is, even in that way, much healthier. And then when our microbiome is coming from a local source, and if we are getting a similar microbiome that knows how to digest the same food that is growing from that local area, it is a lot more matching. It is a lot easier to get the most nutrition out of the same food that might be grown somewhere else, for example. So that is one very important reason. And local is also very matching in seasons, because our body is in the same season. Our microbiome changes according to different seasons. So local and seasonal is very, very important. We always give that kind of a recommendation.
That's very helpful, Rashmi. So, like I said, I would like to carry this conversation for other GI conditions. I'm aware
Yes.
that today might not be the most appropriate time, but I have a clear focus on inflammatory bowel disease, which is another huge
Yes.
disease burden where the
Yes.
understanding of simpler interventional measures is lacking. In fact, we've moved away towards more and more stronger biologicals, antibodies, But I can clearly see that that might not necessarily be the most robust approach.
Yes.
And anything
So
that
it is
is,
interesting you brought in this point because even if we talk about the irritable bowel syndrome, for example, when I say that we find infections in these people, so it is possible that these infections are just above the threshold level. Maybe they are not full-blown infections at that point. But the problem here is that the gut microbiome is so dysbiotic at that point that the presence of these pathogens just exacerbates the symptoms of IBS, and they are not able to assimilate nutrition from the food that they're eating. And most people already have a very unhealthy lifestyle, unhealthy nutrition. So there are multiple layers to it. Even if we talk about inflammatory bowel disease for that matter, the problem here is that even if that infection or whatever it is, the reason for it is identified and they are able to get rid of it, the environment is still the same. They need to change the environment as well to improve the dysbiotic microbiome, to make it eubiotic or friendly or healthy. So that is something that is still, we have to catch up in that. That's why we first recommend fixing the lifestyle. That is the first thing.
I completely agree with you. Like I said, let us actually extend this conversation next week to how we actually can help inflammatory bowel disease from a practical perspective. How we can actually use the gut microbiome analysis, how we actually can
Hmm.
manipulate it. And I'll tell you some very classic observation that we've seen. A lot of people who were diagnosed as IBS for a very long time ultimately turned out to be IBD. In other words, exactly what you said a minute ago, that the dysbiosis just increases, and once it's beyond a threshold, you can see the inflammation, right? But that is not to
Yes.
say that we actually can't pick them up earlier. So it will be very important from my perspective to start thinking about how is it that IBD can be helped with the gut superhero.
Yes, absolutely. So when we talk about any issue in the gut or anything that causes dysbiosis, when people have even mild dysbiosis, it is going to cause leaky gut. It is going to cause leakage of toxic materials, waste, the undigested food and pathogens that are present in the gut by that time in the circulatory system. And then it is going to cause inflammation everywhere in the body. The first inflammation might be in the gut itself, and that can lead to so many inflammatory conditions, so many irritabilities, and all of the diseases that we know of. So definitely that
Exactly.
is a very good point to start the discussion about, first starting with the gut microbiome and then moving to different aspects of what might be
I
going
look
wrong.
forward to that talk. But just to summarize what you've told me today for the benefit of how I'm going to utilize, is that people with IBS, your bloatedness, your constipation, your diarrhea, doesn't always need medicines. It sometimes just needs a healthy diet, a healthy lifestyle, and a manipulation of your gut flora through dietary means. And this can stop you from being dependent on medicines for a very long time, sometimes for years, just to keep your symptoms at bay. On that note, Rashmi, thank you so much for inviting me today. But I would look forward to talking with you again in this series and discuss inflammatory bowel disease.
Thank you so much for the wonderful insights, Abhay. And we always start from the gut microbiome and then start looking at different conditions. So this is a good meeting point where we are looking at the perspective of how things are in the clinic, on ground, and what is the reality that you see. We are focusing on the other, and it's a very good idea to collaborate and come to some kind of a, middle ground where we find solutions to all of these issues that go on for years that cause so much discomfort. So
Thank you.
thank you so much. Thank you.
Thank you.
So if you found this helpful, if you or anybody are suffering from irritable bowel syndrome or any of the gastric disorders that Abhay just spoke about, do watch our podcasts. They are going to be life changing for you because there are solutions, there are lifestyle changes that are required, there are diet changes that are required. Even if we think we are eating a very healthy diet, the way we eat it, the way we prepare our food, the combinations that we eat, and the timing, there are many, many factors that we can consider. So if you are having any issues with or relation to the gastric conditions, do watch these podcasts. They will be highly informative. See you in the next one.